Greetings, Doctor. My name is Hong Changjie, one of the members from Group 10. Today, I would like to introduce about decoding brainwaves, bridging neuroscience and engineering through advances in EEG signal analysis and applications. Now, I would like to share about what are the contents that will be shared during this presentation. Number 1, role of electroencephalogram, which is known as the EEG, and number 2, the relevance of EEG in human anatomy and physiology by our friend Adriana. Next one, general principle of EEG and role of EEG in neurological disease diagnosis and psychiatric disorders diagnosis by Nabila. Furthermore, we will proceed about the limitation of EEG and how to improve EEG by our leader Yongler, and the last but not least, conclusion have been done by the Hafiz and the references. For the introduction, an electroencephalogram (EEG) is a diagnostic tool used to measure electrical activity in the brain by placing small metal discs, which are known as electrodes, that attach on the scalp. This enables the scientists to measure and analyze the electrical signals generated by the brain. Now, I would like to pass the time to Adriana to explain the role of EEG in more detail.
An electroencephalogram or EEG is a vital medical tool used to measure the electrical activity of the brain. It is crucial in diagnosing and managing conditions like epilepsy, where it helps identify seizure types and triggers. EEGs are not only key in detecting seizures, but also assist in diagnosing disorders like Alzheimer's, sleep disturbance, and neurodegenerative disease. By analyzing the brain's electrical pattern, EEG also help in assessing brain trauma, drug intoxication, and even monitoring unconscious patients, especially those with disorder of consciousness. For patients in a coma or after a stroke, EEGs can detect non-convulsive seizures that may hinder recovery and guide treatment. EEGs also play a role in mental health. Brainwaves like alpha, beta, and theta offer insight into states of anxiety, depression, and more, helping clinicians diagnose invisible mental health conditions. In addition to the traditional scalp EEG, more advanced methods like electrocorticography and intracranial EEG provide detailed insight when needed. From seizure detection to mental health diagnostic, the EEG continues to be vital in understanding and treating brain activity. An EEG plays a crucial role in understanding human anatomy and physiology by tracking the brain's electrical activity. This vital tool reveals how our brain processes information and coordinates the body's function. EEG records electrical signals produced by neurons, giving us a clear view of how the brain responds to different tasks, even under varying conditions. While it has excellent temporal resolution, EEG has lower spatial resolution, making it ideal for observing the brain's real-time function. EEG is especially important in studying disorders like epilepsy, where abnormal electrical signals lead to seizure. By identifying these irregular brainwaves, doctors can understand the underlying causes and triggers better. EEG also offers real-time monitoring of brain function, even during surgery. It helps doctors ensure the patients are not overdosed on anesthesia by tracking their brainwave pattern throughout the procedure. With its high temporal accuracy, EEG helping shape the future of brain monitoring, from treating neurological conditions to ensuring patient safety during surgeries.
Hi, my name is Nabila Izzati Rodia Putri binti Muhammad, and I am going to start my presentation with the general principle of EEG. In EEG, electrodes are commonly placed using the 10 to 20 international system during 20 to 30 minute session to detect abnormalities in brain waves at specific brain regions, aiding in the diagnosis of conditions like epilepsy. This method accelerates diagnosis, enabling prompt and effective treatment planning conditions. Firstly, let's look at roles of EEG in neurological disease diagnosis. The first disease is epilepsy. Epilepsy is primarily defined as frequent and unpredictable disruptions in brain activity, also known as epileptic seizures. It helps neurologists study fluctuations from synaptic activity in neurons during epileptic seizures. It also confirms diagnosis and identify the specific type of epilepsy. In epilepsy patients, abnormal patterns are detected to identify affected brain regions and associated epilepsy types, which is generalized epilepsy, focal epilepsy, and temporal lobe epilepsy. The second disease is coma or severe brain injuries. A normal EEG shows rhythmic brainwave activity, but in comatose patients, it may reveal refuse activity such as low rhythms or electrocerebral inactivity or period bursts of delta or theta waves, indicating residual brain function despite unconsciousness. EEG helps in assessing depths of coma by showing residual brain activity in respective areas and frequencies. In prognosis evaluation, positive prognosis is indicated by a normal or mildly abnormal EEG. Conversely, a negative prognosis involves absent brain activity. The next role of EEG is in psychiatric disorders diagnosis. The first disorder is schizophrenia spectrum. Schizophrenia is characterized by disorganized brain activity and dysfunctions in cognition, emotional regulation, and perception. Role of EEG starts at early diagnosis of schizophrenia, where subtle EEG abnormalities are detected. Patients prescribed with antipsychotic drugs are tested with EEG to detect abnormalities in their brains for effectiveness of the medications and improving treatment plans. The next disorder is autism spectrum disorder, or also known as ASD, which is characterized by persistent errors in social interactions across multiple contexts. EEG helps detecting irregular brainwaves linked to sensory and cognitive impairments, measuring sensitivity to visual, auditory, or tactile stimuli in individuals with KSD. Now, let's relate the integration of technology in EEG with human anatomy and physiology. First, the cortical localization. EEG electrodes are placed in locations according to brain region areas, guiding doctors in diagnosing diseases and during surgery. The cerebral cortex is mapped into functional regions, which EEG can separately read during diagnostic evaluations. Secondly, is portability and comfort. The EEG electrodes are designed for comfort, so the patients are able to make minor movements and hence allow longer sessions, capturing intermittent aura events that might not occur during a short clinical visit.
Hi, a very good morning to everyone. Today I'm going to talk about the limitation of EEG. While EEGs are incredibly useful, they do come with some challenges. First off, there are technical issues that can interfere with the signals. Things like muscle movements, eye blinks, and even heartbeats can add noise to the data, making it very hard to get a clear picture of what's happening in our brain. Another limitation is that they have shorter recording duration. Most EEG systems use gel-based electrodes, which can be very uncomfortable for the patients, especially when monitoring over long periods. So this can be a problem when you need continuous monitoring, like during a seizure or sleep study. And lastly, there are logistical barriers. Traditional EEG setups can be pretty time consuming, and you need specialists to attach the electrodes, monitor the system, and analyze the data. In emergency situations, this can lead to delays in diagnosis and treatment, which is definitely something we want to avoid. So what are the improvements that can be made? First off is remote monitoring. Remote monitoring allows doctors to check EEG data from anywhere, so patients don't need to go to the hospital for their tests. This cuts down on their waiting times and make it easier for doctors to make quick decisions. Another great advantage is long-term monitoring. With remote EEG, patients can wear the device at home and be monitored for a longer period. This could help the doctors to catch rare brain events like seizures that might not show up in short tests. Longer monitoring gives doctors more information to make better diagnosis. Patients also benefit from wearable EEG devices that don't require being tied to the hospital. They can move around freely and continue with their daily activities while being monitored at home. This is more comfortable for the patients and reduces their need to visit the hospital. In short, remote EEG improves comfort and efficiency. It helps the doctor to make faster and more accurate diagnosis while giving the patients more freedom. Another advancement that can be made is the invention of wireless in-ear EEG devices. So, in-ear EEG devices use ear canal to be the stable spot to record our brain activity. Since the ear is close to the brain's temporal lobe, it provides a really good location for accurate readings. So this change means that the EEG devices are now wireless and portable. So patients don't need to worry about being tied down with wires while they go about their day. When we talk about the materials used, there have been some big upgrades. Traditional EEGs usually use silver or silver chloride electrodes, but after long use, they can irritate our skin. So this newer system has switched to dry electrodes that are not only more durable and also more comfortable and reusable. The great thing is they don't need messy gels, which makes them way easier for long-term use. Another material improvement is the use of per dot PSS, which is a flexible and conductive polymer. This helps make the device more comfortable to wear for longer periods without causing the irritation to the patient's skin. And because these devices are designed to be light and more compact, they are perfect for everyday use without being uncomfortable. Plus, these devices use machine learning algorithms to process the signals. And with that, they can achieve an impressive 93% accuracy in tracking our brain states like drowsiness. So they are not just more comfortable, they are also much more accurate.
So, what can we learn from EEG? EEG is a vital machine used for the study and the mapping out of the human brain. That way, we can learn how the human brain looks and potentially prevent diseases and map out neurological disorders, pathologically and normally. Also, just like every other machines, the EEG has its weaknesses and strengths. That way, we need to learn to improve its strengths and alleviate its weakness so that it can be used in a comfortably and, of course, very ideal in order to find even the most minute of cases that would cause very huge impacts. As biomedical engineers, it's our crucial role to improve that and also create interest and genuine love for the advancements of our EEG machines. That's all from me. Thank you very much.
These are our references. Again, thank you very much for your attention. We are Group 10.